Okay, please start.
Hello.
Yes, we can hear you.
Okay. So once again, welcome all participants, our group members. Today we are starting the discussion on competencies, right? And to start with the competency of general microbiology, and we will go according to, then next would be immunology, and then systems would start. And there are group members and leaders who are there. So group leaders will require to complete their task, and one by one they will be presenting their competency and SLO, and this will be for half an hour, and then we'll be having a discussion for something around 20 minutes, right? All can raise a question and we'll try to solve the common problem. So today we have got our group leader from general microbiology, Dr. Kunjan Kikani. Is a professor of microbiology at Shivsha Medical College, Surendranagar. So, Dr. Kunjan Kikani, you're most welcome to present competency and SLOs of general microbiology.
Okay. Thank you very much, sir. Am I audible?
Yes, you can go on.
Okay. Thank you very much, sir. So before starting the competency of general microbiology, I'd like to thank Sanjay Bedi sir specially and all the lead faculties, Dr. Sanjay Mehta, Dr. Purnima, Dr. Prakash and other, because this is something which should have been done by the central bodies, but they are taking the lead and guiding us, and we try to follow the uniform pattern throughout the nation, and that is a huge task, and with help of all the dignitaries of the subject we are able to do it. So with this introduction we are starting. Is my screen is visible? PowerPoint?
Yes.
CBME?
Yes, visible.
Okay, so we had a team of few people: Dr. Sophia, Dr. Jasbir, Dr. Deepak, Dr. Vaidehi, Dr. Rosie, Dr. Kazi and myself. So we have decided and done the few competency. As this is the first session, there may be few gaps in the expectation, so we try to correct it. This is a live document, so it is visible to all, the Google Sheet, and we would like to correct the things as per the inputs of the experts and the other members. So what we have done, basically in general microbiology there are 6 competencies. The first is 1.1 is describe different causative agent of infectious disease, the methods used in their detection, and discuss the role of microbes in health and disease. We have given total 11 sessions for this competency. The reason is very simple, because though it is a single competency, but before what we were doing, we were taking one by one, like bacteriology, we were taking session of bacteriology, then we were starting parasitology. So initially there would be introduction to parasite, classification of parasite. Same way we were starting virology, so the general properties of virus, its replication, the methods of viral growth and all that. So now there would be no scope of such different session, because now we have to go as per the system. So when blood would start, CVS would start, we have to take HIV in that. So before that they must be knowing the general properties of virus. Same way for fungus, parasite, all. So we have tried to incorporate all that in this competency. So there are 11 sessions. Then second competency is basically of dope, in which they are supposed to perform. There are 4 practicals in this. One is basic microscopy, where they do the microscopy and focus the thing. Then we have one for gram stain, one for Zn stain, and one for stool routine microscopy. 3 different sessions for each. Then there is a one, describe the epidemiological basis of common infectious disease. We have a single session here. If we wish, we can make it two also, where one can be our lecture that may be followed by the student-led seminar or such thing. Then 1.4 is classify and describe different methods of sterilization, disinfection. Discuss the application of different methods in laboratory and in clinical and surgical practice. We have two sessions. One is the lecture and other is the small group discussion and demonstration. In 1.5 also, choosing the most appropriate method of sterilization and disinfection to be used in specific situation in laboratory. So here also we have got two sessions. One would be interactive lecture, other would be followed by the discussion. And in 1.6, which is mechanism of drug resistance and the antimicrobial susceptibility testing and monitoring of antimicrobial therapy, we have got 2+1, total 3 sessions, in which 2 sessions, one would be the lecture, other would be the demonstration and group discussion, and one SDL can be designed in this, because the microbial resistance is an important thing, and they must know about the common multi-drug resistance organism, and they should come out with its implication in the clinical setup. So we thought that it can be kept in SDL. The teaching learning method required for this would be total 24 session would be required, in which as MCI has suggested that ideally 1/3 should be the lectures. So ideally there should be 8 lectures, but we have taken some liberty and we are keeping 9 lectures. There would be 10 small group learning method. It includes group discussion, it includes demonstration, etc. 4 performance dope sessions would be there, and 1 SDL. So that is the thing. Now I'm going to Google Sheet where we can see the competencies. So this is the first competency. 1.1. In that we have taken the total 11 sessions. So first would be introduction to microbiology. These are, it would be a lecture. Teaching learning method would be lecture. And the SLOs common that at the end of the lecture of the group discussion, the second year MBBS student should be able to, first is describe different branches of microbiology, describe the scope of clinical microbiology, enumerate the classes of microorganism with suitable examination, and describes Whitaker's 5-kingdom classification of microorganisms. So that is the first competency. In second, it would be demonstration of microbial world. So there would be 4 classes of microorganism: virus, bacteria, fungi, and parasite. So we may give a demonstration of one representative organism class, and we can discuss the common from each class. Then history of microbiology, as such it is not there in the competency, but it is important to know the development of microbiology. So we have dedicated one lecture in that, in which the SLOs would be enumerate important milestones in medical microbiology, describe contribution of Louis Pasteur and Robert Koch. Both would be given a separate SLO because their contribution is much more. And one SLO would be the development of chemotherapy, especially contribution of Paul Ehrlich and Alexander Fleming. So antibiotic, pre-antibiotic era and antibiotic era. So they should able to understand that. Then we are moving to bacteria. So introduction to bacteria in health and disease. So we will describe what is normal flora and its benefit. It also includes the distribution of normal flora in the various parts of body. Describe what is opportunistic pathogen, what is pathogen, and after pathogen the pathogenesis, the virulence factor of bacteria and how it produces the disease. Then we are coming to next step, and that is bacterial morphology. Again, it would be a lecture in which salient feature of prokaryotic cell, describe shape and arrangement of bacterial cells, and describe structure and function of various cell organelles. So it would include cell wall, flagella, cytoplasmic membrane, plasmid, nucleus, etc. So that is the morphology. Then there would be practical demonstration. It would be culture media and methods that would take care about the physiology of bacteria, also how they grow. So it is first would be classification of culture media, then describe enrichment, select so different type of media with suitable examples, describe the growth curve of bacteria, the anaerobiosis, and various inoculation techniques, culture methods, and its uses. Sorry. Then the identification of bacteria, in which again it would be demonstration, enumerate the common biochemical reaction and its use, use of automation in identification of bacteria. So we can discuss the principle of various instruments like BacT-Alert and all that, and molecular techniques for the identification. So we can discuss recent techniques in this. Now we are coming to viruses, because as I said earlier, that we need to introduce each classes of organism in this competency. So in virus, first would be general properties and the classification of the virus, in which general features of virus, structure and symmetry of the virus, its replication, and classification, RNA virus and common viral diseases. And one would be about the lab diagnosis. So in that, the use of microscopy and the inclusion bodies, use of tissue culture. Okay, this tissue culture, serological methods for the diagnosis of virus, and molecular methods for the diagnosis of viral disease. Then the theory lecture for fungi, in which we'll discuss the general features of fungi, classify the fungi on the basis of its morphological form and the taxonomical basis, and enumerate different mycosis like superficial, cutaneous, opportunistic, etc. After that, there would be lecture of parasite, general properties and classification of parasite. So in which classification of protozoa with suitable example, classification of and common protozoal pathogen, same way classification of helminth and common helminthic pathogen, and the common methods for the laboratory diagnosis of parasitic diseases. So that would complete the first competency. Second would be entire dope session. Okay, in this I wanted to show. So this is teaching learning method. This is the domain. So all would be from knowledge domain, while second competency, the domain would be skill, because they are supposed to perform, and level would be performance. So first would be of microscopy. This competency is devised by Dr. Sufia, and there would be 4 dope session in this, in which they have to first we would demonstrate, they would observe, assist, and finally perform. So that is dope session. So in first, they must know the magnification and resolving power of microscope, different type of special microscopic techniques, and finally they should be able to focus the given slide. So that is the performance correctly in the different objective lens like low power, high power, and oil immersion. Then gram stain, again it is performance. So there are SLOs like list out various methods of staining and its uses, because this is the first session of the staining. Then principle of gram staining. Then they should be able to perform independently gram staining, document the finding of gram staining with suitable diagram, and they should be able to interpret the result of gram staining. So these are the SLO. Same way it is for ZN stain. In ZN stain, along with that, there would be interpret the result as per the RNTCP or now NTP guideline. Then stool microscopy, that is the fourth top session of the, in which they should be able to perform independently stool mount preparation, identify the ovocyst, larvae or trophozoite in the given stool preparation or the diagram, and there should be document the finding by with suitable diagram. Then 1.3, again it is devised by me. Here there is a query whether we should keep one session or two session. This would be alignable with community medicine. It is the describe epidemiological basis of common infectious disease. So there would be either lecture or the small group discussion followed by student seminar. So some of the topic may be given to them in seminar. So basically the SLOs would be enumerate the global burden of common infectious disease, describe common infectious diseases in India, describe the natural biological diseases, describe different routes of transmission with suitable example. So they should be able to describe all the routes like airborne or the by the ingestion or the waterborne, direct contact, STI, etc. And enumerate common strategies to prevent infectious diseases. So that is 1.3. In 1.4, it is devised by Dr. Kazi. It is about the sterilization and disinfection, classify this and describe different methods of sterilization and disinfection, discuss the application of different methods in the laboratory in clinical and surgical practice. So I'm just showing you, sorry. Okay, so there would be two sessions. One would be interactive lecture. It would be knowledge and some of the competence up to level of knows how, shows and shows how. So these are the SLOs, like classify the methods of sterilization, enumerate these methods correctly, explain principle and mechanism of action of different methods of sterilization and disinfection, so like autoclave and all that, the principle, functioning of various equipment used for sterilization, apply the knowledge to select appropriate methods of sterilization and disinfection based on criticality of the instrument. So classification of various thing would be done, whether it is non-critical or critical or semi-critical. Explain the importance of these methods in clinical and surgical practice, and explain various monitoring methods, so controls of sterilization. So these are the SLOs for this. For MI 1.5, that is choose the most appropriate method of sterilization and disinfection. This competency is taken by Dr. Vaidehi Mehta. Here the SLO, there would be two sessions. One would be demonstration, that would be followed by small group discussion. So it may be a kind of group discussion or the tutorial can be arranged. So in a given specific condition, they should be able to identify the correctly the method of sterilization. Uh, like this, student should be able to identify the items from the given list which are sterilized by autoclave or same way by hot air oven. Sorry. And there are various methods, typically the endoscope, ETO machine, the OTs. So all the clinical settings would be taken in this session. After that, there would be last, and that is about mechanism of drug resistance and the methods of antimicrobial susceptibility testing and monitoring of uh, antimicrobial therapy. So here we have devised basically 3 sessions. One would be the lecture that would guide the student about that. Then there would be demonstration in which we will show the uh, antibiotic sensitivity testing by disk diffusion method, as well as if it is possible by the automated machine MICs. And finally there would be SDL. So they may be given the topic, and specifically we have devised these two in SLOs that explain the effects of antibiotic misuse. So they would know uh, from the practice that how antibiotics are overused or misused and its implication, causes of and effect of drug resistant organism on healthcare. So they would come out with the various implication, the increased stay of health, increased cost, and may increase morbidity and mortality of the patient. And there are different SLOs like classify antimicrobial agents and the mechanism of resistance, uh, define antimicrobial resistance correctly, enumerate and describe accurately 2 types of acquired and intrinsic antimicrobial resistance, mechanism of resistance, classes of beta lactamase, um, importance of antimicrobial susceptibility testing, various methods, and these are the things: e-test, automation, various terms which are very clinically important like MRSA, VRE, VRSA, ESBL, etc. And these two we have already discussed that should be done in SDL. This was prepared by 2 persons, Dr. Rosie and Dr. Deepa. So that's all from my side. Uh, and the topic is open for the discussion and suggestion. Thank you.
Okay. It was an excellent presentation, Dr. Kunjan, and I really appreciate the work which is being carried out by the team General Microbiology. It was commendable work, and I think everything, almost everything you have covered, most of the things which are there. And one thing
Yes.
is parasitology, you can also put that demonstration, right?
Yes.
Like which we have put for bacteriology.
Actually, yes. Actually, we had one demonstration of stool preparation in
Okay.
MI 1.2. So we have skipped because already in MI 1.1 there are so many. So we can shift that practical after parasitology lecture. So
Okay. So,
that's why it was kept.
so can you just tell me what was the difficulty or in designing this one?
Actually, as this was the first time we were doing, we were slightly clueless how to go about that. But I am a fortunate one that I have yourself in my department, so I had some idea regarding that. And second thing, we had a internal WhatsApp group. So we used to talk to each other in WhatsApp group, and all were doing it in Google Sheet. So,
Okay.
and
So
most of them are very versed with Google Sheet. So there were not problem. But again, it is, as I've said, it is not the final. It requires some modification also as per the need of.
So now topic is open for suggestion or questions, right, from the participants. Please raise your hand and please come out with your suggestion or questions.
In chat, there are some questions. Dr. Sain Lila has said, MI 1.3 can be arranged as an integrated session with SPM.
Yes.
MI 1.0 integrated with surgical department, there will be not be repetition.
Yes, 1.3 that should be aligned with community medicine. I have already said in my presentation, because most of the things that would be covered would be the epidemiological method. So it would be fine if it is aligned, and especially when student what we have planned, that student seminar may be planned. So, and community medicine expert should also attend that seminar, so they will give their inputs regarding the prevention and the especially the importance of laboratory in the diagnosis of the communicable diseases, breaking the chain of the infection, the diagnosis of various epidemiological processes. So that should be done.
Dr. Ranjani Shyam Sundar.
Thank you, sir. I have one basic doubt, sir, with this whole approach from our regular teaching to CBME as to how much of microbiology we should be telling them, because they just want from point of view of a medical graduate. So whether we should be talking about history and culture media, biochemical reactions in detail, or just enough so that antibiotic action, pathogenesis, the gold standard tests, when to ask for a test, how should I send for it, when will the report be ready, how to interpret. Is that much enough, or we have to go in detail the way we are going about now? That is my basic doubt, sir.
Okay. Should I answer this? Hello.
Okay, sir.
Yes, please.
Basically, again, that was the question for us, and we have deducted so many things. We have kept one session for culture, media, and methods. So, what I think that now we should not ask about the mechanism of MR reaction and Voges-Croskus test. We should
Yes, sir.
omit that from our teaching, because that
Yes.
is not going to help the medical graduate.
Yes, sir.
What is our goal is to make a person that is okay for the PG student in microbiology. They should know the mechanism of biochemical tests. What
Yes,
we
sir.
are more interested would be how this biochemical test would help them to diagnose. So if they remember the names, that would be more than sufficient for me. So we have kept one session for culture media and one
Okay.
session for identification. So they would know that these are the tests, but we should not go in the much detail of, like in TSI, what 3 sugars would be there, which we were used to ask. But
Yes.
instead of that, what are the for example, they should be know that if UTI is there, what are the organism they should suspect that may cause the,
Yes, yes,
and
yes.
if gram negative is there, what antibiotic should they start. I think for clinical microbiology point of view, that point are more important, and so we have to shift our focus from subject to the how it would help them to diagnose. That is the my view.
Thank
Good
you.
evening, ma'am. Dr. Mukesh
Yes.
here, ma'am. Can I
Yes, sir.
order, ma'am? So
Sure.
actually, ma'am, as a undergraduate, once they become intern and or they go to the field, ma'am, at microbiological point of view, they should remember that if mainly about the what sample to be sent
Yes.
and what process to be sent, what time to be sent, because this is the
Exactly. That
basic
is what
things.
I also thought. Yes.
So that we have to concentrate more on that, because after internship, what part of microbiology they have to know must. And
Yes.
we know that the reports get wrong when there is a collection and transport is not proper in the sample, ma'am. If you current
Yes.
situation, if you will take, ma'am, the COVID-19, lot of problem. One patient today is coming negative, tomorrow is a positive, next day is coming like that, ma'am. So if you go like that, it's all total depends on how we are collected the sample, how it has been transmitted, how it has reached to us, because the clinicians will be depending upon the results, ma'am, and their decision will be depending upon our this one. So as an undergraduate, they should know how much they should know about that time. If once they
I
become
also.
microbiologist, they will be knowing detail, no issue, ma'am, everything about the microorganism.
Okay.
Thank you, ma'am.
Yeah,
So what do
may I
you
say
feel,
something?
sir? Yes, sir.
Madam, yeah, may I say something?
Yes, sir.
Number one, this is a live document, open document. First of all, let it be very clear, right?
Okay, sir.
So we will make changes as per the suggestion and as per the uniformity what we decide, right? There is no problem. What we
Okay.
have been doing, or what we have been doing till now since years, and gradually we'll have to let go several things, right? So this is a process which we have started to let go.
Yes.
But the students, there are two things. Now we are letting it go, but we should be also be very careful that we are not asking the same questions in their examination. If we are once again going to
Yes.
put the question of TSI, we are once again will go and read TSI only, right?
Yes,
So we'll
sir.
have to change in that way. Second thing, what is important for MBBS is what Dr. Mukesh said is very right. That is sample. But along
Yes.
with that, what is also important is that the spectrum of the tests available. Suppose they
Yes,
are
sir.
suspecting a
Yes,
case of cholera, at least they should know which are the different tests available for enteric tests or for the
Yes.
bacteria or the
yes,
virus.
sir.
And that is why demonstration is very important, that these are the different tests which are important. So we
Yes,
can
Yes.
skip or we can minimize that culture media and culture method, which is not that much very much important. That is
Yes,
very
sir.
right.
That's what I said.
yes,
Yes.
thank
Yes.
you, sir.
Thank you so much.
Oh, welcome.
Sir, one more, while going through this SLOs and also, one doubt is there, lot of places we have used describe and explain. So describe and explain, again, it becomes a broader word, sir, in the SLOs, sir. Can we minimize it? We'll be using some better words instead of describe and explain.
Describe is a very scientific word, and it
Okay.
is used, right, when you are going to say the first thing, enumerate, when they are just going to list that, right?
Yes, sir, yes, sir, yes, sir.
When you are looking for some more answer, like
Yes, sir.
pathogenesis, you can ask the describe, right?
Okay, sir. Yes, sir, yes,
Explain
sir.
is some a liquid word. What you said is very right, right? Explain is something usually when you are going to go for a assessment of comprehension to higher level of that one.
Yes,
But
sir.
you are very right. Explain can be replaced by some other thing. But what word we can put, that is once again, because explain can be asked in viva or in oral examination. Better in
Yes, sir.
better way. In better way.
Yes, sir. So we need to do some we'll do it in the Excel sheet. We'll do at that time corrections, sir, right, sir? We can, sir,
Yeah,
if you find some
yes,
better
yes.
words.
No,
Yes,
definitely. You can just go through Google through that all word which was taken by Dr.
yes,
Purnima, right? Which
yes,
are the
yes, sir.
appropriate word which can be used. One more thing which I would like to say, that you have seen this SLO at many a point. If you try to compare this SLO with the smart SLO, you will not be able to
Yes, sir.
find
Yes,
certain terminology. See,
yes, sir. Sir.
using all that A, B, C, D terminology and each and every SLO will become very tedious job, right?
Yes, sir.
So
Yes, sir.
yeah, when you prepare your SLO, especially for cognitive domain, you can write in the first at the end of the session, second MBBS phase student would be able to do blank correctly,
Yes, sir.
and then you put SLO. That SLO directly you can take it for assessment. It will be the question only, right? Describe or enumerate or define. It will become one and the same thing.
Because our assessment directly reflect our SLO, sir. So
Yes,
मेरे को
yes.
so we plan our assessment, and then on that basis we can write our SLOs,
Yeah, yes,
because
yes, yes. Very right, very
limitation
right.
of time is also there for us. So that's why, sir.
Yes, yes, yes. That is very right. So it should become almost similar. Right?
Yes, sir. Thank you, sir.
Any other suggestion, question from the audience?
Dr. Sufia Siddiqui. Please unmute yourself. Dr. Sufia, there's a red button on your side on a panel. Please just click it. Unmute yourself.
Sir, will we be able to access all the SLOs from your Google worksheet? Will you upload all the SLOs? Hello?
Can you repeat your question once again?
Sir, will you upload all the SLOs on the Google worksheet?
Madam, it is
Ma'am,
already there in the common sheet. It is accessible to each and every participant. You just try to
Okay, sir.
go to the Google Classroom and
Okay,
go
sir.
in one topic that
Okay,
is
sir.
group work, and that sheet is there. And you can copy down, you can take to your PC, or you can work over there, right? It will be accessible, and it will be there at the end of this
Okay.
webinar. At the end of this series of webinar, you will be having a list of SLO which is prepared by this all microbiologists all over the India, right? It will be ready-made available to you.
Okay. Okay, sir. Thank you, sir.
Welcome.
Dr. Preena Bhalla.
Okay, now I am unmuted. Thank you. I feel we have got in MI 1.1 7 lectures, 4 demonstrations. Why are we doing demonstrations in this competency? Because this competency, the teaching learning method recommended was basically lectures. And in the next DOAP, we can demonstrate, make the students perform. It is part of DOAP. We should not merge the lecture teaching part with the DOAP. That's what I feel. For example, we are not demonstrating Albert stain. Don't you think it is important to teach the student Albert staining? That is one point. The other point is demonstrations should go into 1.2. MI 1.2. All demonstrations, practicals, DOAP. We had listed a huge number. Even culture media, we were demonstrating there. Staining methods, grams, ZN, Albert. We even included for fungi, we also said KOH and lactophenol cotton blue slides. We had included a lot of practicals and demonstrations in MI 1.2, whereas here we are including 4 demonstrations. I don't see the point in demonstrating. We should merge some lectures. Oh, sorry, can I give another point? For example, introduction to microbiology is usually combined in our previous schedules with history of microbiology. We combine these two into one session because it's not too much. Introduction to microbiology and history, we don't want them to know too much detail about it. We just want to give them a bird eye view. Then we can group together general properties and lab diagnosis of viral infections. Then similarly, fungi can be in one lecture, bacteria can be in one lecture. I feel 7 lectures in this is a bit too much. Thank you. That's what I wanted to say.
okay,
Dr.
thank you very
Kunjan, would
much.
you like Kunjan?
Yes. Basically, the first competency is, it reads like this: describe the different causative agent of infectious diseases. The
Yes.
methods used in their detection. So
Yes.
methods used in their detection would require the knowledge of culture media. So culture media demonstration should be there.
That can all
Here.
be covered in lecture. And in the DOAP, we will demonstrate the culture media.
But ma'am, the culture media would be more easily understood when they see, like Mekong ki agar, blood agar, everything.
I
If they
understand, but mainly we
so,
should take
so
lectures with
demonstration
my
is
1 point.
basically what we have thought in. It is always we can change and reduce it. But what we thought in our group discussion, internal group discussion, is
Of
like
course.
in culture media, we will first take some theory part that, but finally they have to see each media. So that is there. Uh, while what you have said about the Albert Stein, so in competency 1.2, what they have said is perform and identify different causative agent of infectious disease by gram, Zn, and stool. Albert would
Right.
come in the diphtheria, so it would
Okay.
come in
But
the
I think
respiratory.
we can demonstrate to them, in this, even if they've excluded
Yes, ma'am,
Albert's here.
yes, madam, it is already there. For example, if you see first stain, because from there our staining is starting. List out various methods of staining and its uses. So it would be done, but they are not doing Albert stain here, as it is not in this competency 1.2. So it is already there in the diphtheria.
Of course, it
So
must be
we have
there.
not touched.
Similarly,
But yes,
Zn
what you
will be
have
there in
said is very correct,
mycobacteria.
because we in first competency there are 11 sessions, but this competency almost includes entire general microbiology. So we have included, but yes, we can reduce as per our need of time and all that. It can be very well. So it is open for the suggestion and discussion of all. We can always reduce it, but these are the demonstration of something which they have to see, like identification of bacteria. Again, it needs to be demonstrated various biochemical reaction and all that. Then instead of theory, they would understand it better. That's why we have kept demonstration of that.
Okay, may I add to that something, madam?
Yes, please.
See, MI 1.1, we are talking about the general aspect only, right? Second thing is that MCI document which is given is the minimum standard like that. There is no problem if you go for the higher level of a learning or teaching.
Yes.
There
Okay.
is no issue in that. MI 1.1, they are talking about performance. So if you include everything over here, it will be difficult, because gram stain, Zn stain, and stool routine microscopy, they are supposed to perform 5 times. So it is not possible to put all that culture media and everything over here. It is better. So there are two things in MI 1.1. One is a lecture and other is small group learning. Small group learning, you can go for demonstration, you can go for practical, you can go for any other thing, group discussion and everything, in which they see, they do, and they will understand, and then they can reach up to know-how level, right? So level is very important for that. And only giving lecture, you will not be able to reach to that particular level. Second thing, one more limiting factor over here is that initially when we tried to devise our timetable, we could not reach to 180 hours, which is recommended by Medical Council of India. So initially also we have only kept few lectures and few practicals and like that, but we could reach hardly up to 140 hours. But the problem is that that is minimum requirement is go up to 180 hours, and that is why we had to separate out all this thing.
Okay.
Just for you, madam.
Right then. Thank you. Thank you very much.
Thank you, madam.
Uh, Dr. Anand Janagond has written in the chat, some of the lectures can be converted into tutorials, SGDs, as they have less time. 70 hours is allotted for lectures. Each practical class is for 1 hour or 2 hours. How about including simple stain and hanging drop demonstration before doing gram stain? After writing, he has gone offline.
Okay. So we have done only 1/3 of the lectures are there. Out of 24 session, there are only 9 lectures. Rest of them would be demonstration, small group, and the DOP session. It is already as per the guideline.
But I think hanging
But-
drop preparation is important. That can be included. Hanging drop to
Yes.
check the motility.
That is that we can include in microscopy DOP.
Yes, why not?
That can be done.
Or specifically you can include when you are teaching cholera, right? Specifically when you are
Oh.
teaching cholera, that would be good, because when you are acute diarrheal disease and different methods for that, it will be well suited over there.
No, so I think hanging drop should be taught here in M1.2.
In microscopy, 1.2, when we are describing all the technique of the microscopy, we should include the microscopy, and one more I missed is even we should tell something about micrometry also in this session. So
That
they should understand that also.
Yes, that can
So
be
they
done.
may not be doing that, but so yes, that can be included.
I think once we complete the discussion about all SLO, we'll come to the total number of lecture and small group discussion and SDL, everything. Over there, we can adjust how many lectures to be reduced or what can be increased, and what content SLOs can be reframed. Right? So basically, this is once again open document, and MSA is also saying that it is an open document, and this will go on changing. So definitely we welcome all the suggestions, and we collectively will be trying to make it as good as possible. Yes.
Dr. Kishore Animareddy. Yes, Dr. Kishore. Okay. He has written in the chat. He says he doesn't have a mic. Instead of demonstrations, small group discussions can be done for culture media and culture methods and identification of bacteria.
Yes, that can be done. Only thing why I put demonstration is they can see the culture media, but it should be followed by small group discussion. So it is a broadly demonstration would be part of SGL only.
Yes, it will be part of that only.
Okay.
See here, sir, if you can see in screen, there are 10 SGL. It includes all the demonstrations. So basically it would be that only. There are 4 practicals where they are supposed to perform the thing. So that would include microscopy, where they would focus, gram stain, Zn stain, and stool microscope. So, and there would be 9 lecture. Total session would be 24.
Okay. So I think there are no more hands, and Dr. Muhammad Mukt Qazi.
Yes, sir. Good evening, sir.
Yes.
With due respect to all the senior faculties, I just want to suggest one thing. It is mandatory under the Integrated Disease Surveillance Project to report the notifiable diseases. So I was thinking that in MI 1.3, can we add one SLO stating that enumerate list of notifiable diseases correctly?
Yes, very right. You can always add it. That is the purpose of this large group we are collecting over here and giving suggestion. That is a very good suggestion. And
Yes,
general
thank you.
microbiology, yes, team should include that. And there is one more question initially regarding the integration. See, right now we are concentrating on deriving SLOs from our competency.
Yeah.
Now the problem is that along with that, all other subjects like pharmacology is also devising their timetable, pathology is also dividing their timetable. Once we fix it into weekly timetable, we'll be able to once again sit together and see which are the competencies which can be grouped together. Because if we want them to come in our drug resistance, they will not come, right? If it is happening in that week, and then we can have a common platform and we can have a sharing type of integration. Otherwise, we'll have to go with the nesting. That is a thing. That is a problem, because all of them are doing their work, and then we'll try to focus that which are the nearby possible, and which can be devised into a single session, right? Once again, it is a very difficult task, and we are working for last 3 months, and only few of the topics we have come together that we'll be able to go for integration, right? It is very difficult that if you say that integrate this with surgery and integrate with that gynec, because see, they don't have the timetable right now, and it is very difficult. They will not come as per our conveniency. So once they will be devising their timetable, so it's a very time consuming process and will go for a long time. Is any other suggestion, question?
Dr. Sai Leela. Yes, Radhas Nagarkar. Yes.
Hello, sir. Hello. Hello.
Yes.
I'm Dr. Sailila. Sir, even in clinical subjects have 25 lectures during this second phase also, sir. So the integration is possible with clinical subjects like sterilization. We have to integrate with the surgery. Otherwise, they will not repeat again the same topic.
Yes, madam, very
Hello?
right. First of all, yeah, you are very right.
Yes.
But this is right now we reach up to SLOs, right? We are working on that. If you compare,
Yes, unless we know. Oh.
Yeah, we have reached up to SLO. Yes, we are still devising.
Yes, sir. Sir,
Then,
one more column can be kept integration.
Yes,
which
yes,
topic can be integrated?
just
Integration is not
keeping,
any.
Madam, just keeping the column is not the purpose, right? We'll keep the column, but actually, are we able to integrate that? That would be a problem.
Yes. Yes.
Are you
That we have to keep in.
See, right now,
Yes, sir.
Right now, only first year and second year we are sensitized, and right now part 1 and part 2 they are still far away from this curriculum CBME, right? Because students will come in second MBBS in October, and they will be this curriculum will be implemented after 1 year completion in third year. So that is a problem, that how to call all that people. And once again, this is a huge task. Simply putting that column, we will put that column definitely. We will go for nesting also, because nesting does not require their involvement. We'll go for nesting. But for the sharing, using a common platform, it will be going to be a problem.
And also temporal coordination for antimicrobials, sir. That is also essential because pharmacology people have to take antimicrobials before we take drug resistance.
Yes. Very right. I'm not saying that we cannot do it. We'll have to do it. Only thing is, right now we all are only microbiologists, and we are working on SLO. In your college, you'll have to sit with microbiology and pathology, and then you'll have to identify where you can integrate. That all other subjects should also consent that okay, we'll be able to do, or we'll be able to take antibiotic resistance when you are taking. Right? That will be a great.
Yes, sir. My point is.
Yes.
Sir, my point is, in that SLO itself, if you mention that it can be integrated with that particular subject, we can keep it in mind, no, sir, so that it can be integrated later.
Yes, definitely. It has to be integrated. It has to be integrated. Either you take it or make a common session with pharmacology if possible.
Yes. we can have a number of hours which can be integrated. That also we can have an idea when you keep while preparing SLOs only. If you keep aside that how many hours we can integrate with
Yes,
other
yes, we'll come to,
subjects.
definitely we'll come to that point. We'll come to that point, how to integrate and how to make a common. Yes, yes.
Hello,
Thank you,
sir.
sir.
Welcome.
Hello. I'm Dr. Nagarkar, sir. Hello. Am I audible, sir?
Yes, yes, yes. Please go on.
Sir, my doubt is regarding the SDL, sir, self-directed learning. In general
Yes.
microbiology history of introduction we have taken, sir, and really hats off to the team general microbiology who have designed these SLOs, TLM, and domains for each competency. And congratulations to the whole team. But in history of microbiology, can we add one SDL session also, sir? Just
Yes.
I know that everything to teach is very difficult, but we are missing so many scientists other than Louis Pasteur, sir, and Robert Koch. So can we include just SDL, and in that students will do their activity and they will present to us?
Definitely. See, SDL is, what is SDL? Is a self-directed learning. They are going to learn on themselves, right? We
Yes,
can just simply give them a guidance, and you
yes, sir.
assess
Yes,
that. You can assess that.
yes.
Now you have to see, this is a choice of general microbiology team, that they have taken the topic of antibiotic resistance. They felt that this is important. Likewise,
Okay,
you can also, you feel that history of microbiology is important. You have to think, when a graduate will pass out, what is important for him, history of microbiology or antibiotic resistance. So we can have a
okay.
variability, and it is a highly subjective. So you can devise such type
Yes.
of self-directed learning, no problem in that, right?
Okay. Thank you so much, sir. Thank you.
Oh, welcome, welcome. Is there any query, Dr. Bedi sir? Or we can
I think we can close it now. Dr. Ranjani Shamsundar is saying, can CSSD visit be included in the session on sterilization?
Yes,
Yes.
yes, it has to be. It has to be
It
included.
has to be. It should be there.
Okay.
So it was a great work by team general microbiology. Next, we'll have a presentation of team immunology next Saturday, and we'll go as per the system afterwards. So it will be good to see how other team members are preparing SLO for various systems, right? After general and immunology. So once again, thank you, Dr. Bedi sir, other panelists, Dr. Kunjan Kikani, and the whole team. Right? It was a very nice work and very good input, which is being given by all other members also. So thank you very much for this wonderful session, discussion, interactive session.
Thank you, sir.
Thank you.